Hi everybody! Today we will present to you the therapeutic ultrasound machine. I will show you how this technology works and how it could turn out to be very useful in our veterinary patients. Therapeutic ultrasounds are high-frequency waves emitted by a medical device and delivered through a transducer head. Ultrasound therapy is used in veterinary rehabilitation and physiotherapy for its thermal, non-thermal, and anti-inflammatory effects. Ultrasound therapy produces a mechanic stimulation that facilitates the healing of damaged tissue, such as muscles, tendons, and articular structures. The thermal effect of therapeutic ultrasound increases temperature of tissue, thus giving an increase in blood flow and oxygen to the affected area. Moreover, the heat that is generated increases joint mobility, collagen elasticity, and is able to reduce muscle contracture. Ultrasound helps regenerating tendons and reducing thickening of scar tissue. The non-thermal biologic effects of therapeutic ultrasounds includes acceleration of healing, reduction of edema, and decreased muscle spasm and pain. Globus UltrasoundVet has different ultrasound equipments that can be used on both pets like cats and dogs and horses. Programs and parameters have been preset to generally presenting pathologies on our targeted veterinary patients and according to veterinary medical literature. However, parameters are indicative, and we always advise to monitor single patient's response during therapeutic session and prescribe ultrasound therapy based on specific disease and according to individual needs. When air and ultrasound get in contact without the interposition of water-gel solution in between, and when the intensities are too high, the probe might get overheated. Moreover, keeping the probe still on a spot without moving it constantly may expose our patients to burns. If ultrasound is used on a bony prominence, the probe needs to run over it rapidly and using lower intensities. The frequency determines depth of penetration and is expressed in megahertz. At 1 megahertz frequency, the device produces heat between 2 and 5 centimeters deep. As frequency increases, capacity of penetration decreases. A 3 megahertz frequency produces heat between 0.5 and 2 centimeters deep. What kind of treatments can we perform with ultrasound machine? With these machines we can treat muscle contractures, reacutized chronic osteoarthritis, chronic tendinitis, bursitis, spondyloarthrosis, scar adhesions, and we can increase joint range of motion. Ultrasound treatment can be performed once a day or once every other day. Do not use ultrasound therapy in the immediate post-operative period, and it is always advised to wait for at least 15 days after surgery before starting the treatments. The number of sessions varies accordingly to specific disorders, and as a rule of thumb, acute disorders require fewer sessions, whereas chronic disorders require longer cycles of treatment. The cycle of treatment generally ranges from 10 to 12 sessions. Now let's go over patient preparation for ultrasound therapy sessions. Veterinary patient has to be placed on a comfortable bedding or a comfortable position. Clip the air and disinfect the skin with a disinfectant solution if possible. Hair tends to hold on air molecules, therefore making the penetration of the ultrasound through the cords very much harder. The size of the treatment area usually doubles the size of the transducer head. The probe has to be moved around at all times at a speed of 1 to 2 circles per second. Keeping the probe still may cause skin burns and overheating of the treated area. Do not perform ultrasound therapy on sedated patients, since their feedback is necessary to adapt the treatment parameters to individual needs. If the patient feels discomfort during the session, reduce the intensity or stop the treatment. There are two different ways of using ultrasound therapy. We can use it as a means of direct coupling, and we suggest using this setting for wider areas such as muscle or on tendons. Direct application of the probe is the most used parameter when talking about therapeutic ultrasound. Before applying the transmitting probe on the skin, put some conductive gel on the treatment area, and the conductive water-soluble gel will help with the transmission of the ultrasound, removing the hair between the probe and the skin. The transducer head has to be kept perpendicular to the treatment area. It has to be moved around constantly, putting a slight pressure over the probe that lays in contact with the skin. Be careful to keep moving the probe around, especially when passing over small structures with reduced points of contact, such as bone, as this can cause overheating or skin burns. Another way of using ultrasound therapy is the submersion underwater method. If the treated area is uneven or hard to reach or even too painful to be touched, you can use the underwater method. It is very useful for a condition affecting the extremities, such as phalanges or carpal tunnel bones. The paw or the areas to be treated has to be submerged in a container of tap water at warm temperature, not higher than 25 degrees Celsius. Both water and the skin have to be clean. Use plastic or rubber container, since these materials determine a smaller degree of ultrasound reflection. Keep the probe underwater 1 to 2 centimeters distant from the treatment field to avoid dispersion of the beam and loss of therapeutic effectiveness. The intensity can be increased by 0.5 watts per centimeters compared to direct application to compensate for water absorption. The duration of the application varies between 10 and 15 minutes.